All right. Good morning. We're glad you are here with us today for this second in a pair of webinars about infant and early childhood mental health. I am Diane Bales. I am one of the Better Brains for Babies co-directors. Better Brains for Babies is sponsoring this. We're grateful to our funders at the DFACS Prevention and Community Support section for helping to fund this and all of our Better Brains for Babies activities. I'm going to hand this over right now to Laura. Laura Lucas is the Infant and Early Childhood Mental Health Director at the Georgia Department of Early Care and Learning. And she has a lot of great information to share with us. So Laura, welcome. Thank you for being here. We're looking forward to hearing what you got to say.
Yeah, thank you so much, Diane. So great to be here. I see some familiar names out there. So it's great to see some folks that we're already working together on this initiative, and hope to work with all of you, really. Let me transition into sharing my screen and we'll get started here as more people are joining us. Okay. All right, that should be good, right, Diane? Okay. Good morning. I'm so happy to be here. Thank you for Better Brains for Babies and Diane for inviting me to talk about my favorite subject, infant and early childhood mental health. Let's see. So I always like to start with learning objectives. What are we here for? What are we going to learn? Really, the first thing that we're going to talk about is what infant and early childhood mental health is and why it's important. And I hope some of you were able to attend the Better Brains for Babies webinar from last week, where we had a 0 to 3 expert in infant early childhood mental health present. So this is sort of a part 2, but it's okay if you weren't able to attend the previous webinar, because I'm going to hit the core concepts around infant early childhood mental health today too. But one reason why we're focusing on mental health and children's mental health this week is because it is Children's Mental Health Month nationally. And of course, there's many different agencies that celebrate different children's mental health initiatives this month. So we really wanted to partner with Better Brains for Babies to just sort of shine a light and promote children's mental health this month. So again, thanks for that opportunity. We're also going to learn how child-serving state agencies such as DECAL, public health, behavioral health, developmental disabilities, community health, how we're all kind of coming together to build a better system in Georgia to support children's mental health. And finally, and probably most important, stick around for the end, because we're going to talk about really how you can promote infant and early childhood mental health in your own space. So let's start out with the basics. So the formal definition of infant early childhood mental health is a young child's capacity to experience, regulate, and express emotions, form close and secure relationships, and explore the environment and learn. So basically what we're talking about when we say infant early childhood mental health is just young children's social emotional development, really their capacity for emotional wellness, their capacity to deal with big feelings, to really start that beginning of developing coping skills. We all know in life things don't always go the way that we want them to go. And really how you learn to deal with that is when you're an infant and when you're a toddler. And the way you learn that is through relationships and those bonds with and attachments with your caregivers, your primary caregivers. So we're going to unpack that a little bit more, but that's really all we're talking about. Sometimes when we use the word mental health, people get a little like, what are we talking about? We're talking about mental health, not necessarily mental illness. We will get into that in a second. But mental health is just emotional wellness, and we all have mental health. And obviously children, even young children, have mental health too. And sometimes we don't always recognize that. So one of the quotes that I love to start off with, and I hope most of you have already heard this, it's a pretty widely used quote. But why do we focus on early childhood? Why focus on mental health in early childhood? And really the reason is because of this great quote by Frederick Douglass. He said, "It's easier to build strong children than to repair broken men." So just kind of be thinking about that quote as we talk about early childhood brain development. And of course, I'm sure that you've attended other Better Brains for Babies webinars and probably know that young children have an incredible amount of brain growth in the early years. In fact, 90% of the brain is formed before a child starts kindergarten. And we can't, it's really hard to imagine that 1 million neural connections are occurring every second in a young child's brain. So there really truly is a window of opportunity here for us to build a strong foundation for social emotional health. And we know that the brains of young children develop in response to the environment around them. So again, that's that opportunity piece. What are those relationships like? Are we responding to our babies and toddlers? Are we teaching them and helping them learn coping skills through when they're very developmentally appropriately throwing a tantrum in the grocery store at 2 years old? You know, those are opportunities to teach children and support them around that social emotional health. So also, whenever we talk about sort of life and emotions and mental health, we have to talk about stress, right? We all have stress, just like we all have mental health. Well, kids have stress too. Kids experience stress too. So I always like to sort of present the continuum of stress to trauma, just to kind of lay out that some stress is healthy. Just like I mentioned, the 2-year-old in the grocery store who's just very stressed out because they can't have the candy bar that they gotta have. That's actually, even though it doesn't feel like it, that's a healthy stress because it gives them a chance to practice not getting what they want all the time or making healthier choices. It gives a time for mom or dad or caregiver to practice teaching them how to calm down when you don't get what you want, or how to, again, access those coping skills. Another example would be sort of the first day of childcare where somebody, the child might be a little nervous and it's a little stressful for them. But again, that's a natural life event, and that's something that we need to learn to deal with. That helps us manage stress and learn to cope with that. So then you kind of go into the other area where there can be some emotionally costly stress. So I always like to use example of the pandemic. So that was something nobody could control. You know, there was a lot of stress for parents, especially. And it was just sort of unknown stuff, like what's happening, what are we going to do? But how you balance out that sort of tolerable or make stress more tolerable as it's kind of getting, you know, ratcheting up a little bit beyond the normal developmentally appropriate stress is through relationships. So if you have a caregiver relationship that is there to buffer that stress, then that stress won't lead into traumatic stress. If you do not, and these stressful events keep piling on and piling on and piling on, then it can lead to traumatic stress. So another good example is, you know, what if a young child loses a caregiver? That's a grief. Grief is something that is very real, and infants and toddlers absolutely experience grief in their own developmentally appropriate way. And if you have support around that child and services and supports and caregivers who can buffer that stress, then the child will move on and deal with grief and stress just like all of us have to. However, imagine if there's nobody there to really buffer that stress or address those issues. So then that's when things lead to traumatic stress. And that's when we're getting into neglect, abuse, you know, some of those adverse childhood experiences that I know that you guys are familiar with. So we know, hopefully you guys have already heard about adverse childhood experiences, or ACEs. We know the more of those that you have as a child, the more likely you are to have some negative outcomes later in life. And that can include really all areas of our life: physical health, risky decisions and behaviors. And then also the little blue circle at the bottom that I think we're paying more attention to now, as we should, is opportunities. Because if you don't have access to a quality education, you're probably not going to get the best job, and you're probably not going to make as much money as you need to live. And then that cycle starts over as those adults now have children in the same environment. So that's why we also talk about growing up in poverty, dealing with systemic racism, and things of that nature, sort of those environmental or social determinants of health that can also kind of add up to those adverse childhood experiences, and really lead to that trauma, that toxic stress that I was talking about. So again, as I mentioned, what buffers adverse childhood experiences and really builds resilience in children? Again, resilience is having those coping skills, being able to handle tough things in life, which we all hopefully have or need the ability to do, and hopefully have the ability to. And really that revolves around relationships. If you don't hear anything else I say today, hear the word relationships, because really that's what infant early childhood mental health is about. But even to go a step further, we've really been focusing in the last several years on what is early relational health. What's the importance of early relational health? And really come to find, again, that's a big foundation with really any parent-child or care-child relationship. And we found there's actually been studies that have found the development of problems with child and adolescent mental health can often begin with problems in a child's primary attachment relationship as an infant. So this is why we're talking about early childhood. This is why we're talking about infant mental health, because it starts at the very beginning with the relationships that young babies and toddlers, young children have with their primary caregivers. I did a study in college many, many years ago that really linked children who had a lot of adverse childhood experiences, a lot of specific sort of attachment issues with their primary caregiver, and how they were more likely, a lot more likely, to attach or have relationships, negative relationships with their romantic partners later in life. Because as a child, if you're not getting that attachment, not getting that love and acceptance, that really sort of having that foundational building block of security, then sometimes we find that kids are growing up and seeking that in romantic relationships later on in life. And I think a lot of research has been done in that area. So it's just sort of interesting to think about that we don't really always put a focus on infant early childhood mental health and that early relational health piece, but it really is just like adverse childhood experiences. Those attachments and those relationships really affect who we are for the rest of our life, and some of the decisions we make and how we live our lives. So the key messages here are that the developing brain is affected by children's experiences and interactions with the most important people in their lives. Adults play a critical role in supporting young children's social, emotional development, and brain connections are experience dependent. Early experiences last a lifetime. So those are sort of the takeaways for infant early childhood mental health. So if there's any questions or anything, just put them in the chat box and I'm happy to answer. So let's go sort of to the next level of when we think about the system. When we're talking about infant early childhood mental health, so we understand the importance of early relational health. We understand what infant early childhood mental health is. How do we support young children's emotional wellness? So I find it helpful just to sort of break down what the services are that we're talking about. And if you're in behavioral health or mental health services for other children or families or even adults, you'll find some of these are pretty similar. So we're not talking about some newfangled therapy or putting a 2-year-old on a couch and ask him how he feels. It really is just sort of an approach that you would take in more of it through a family therapy. And I used to be a child and family therapist, again, many years ago. And so I think it's funny sometimes how we think, oh, infant mental health, that's sort of something new. Not really. It's just child and parent therapy. It's just the whole family. You're not going to treat the child on their own, because the relationship is really what we need to work on. And whatever the child is dealing with, they can deal with it more effective through that relationship. So here's just some services that are needed for successful infant early childhood mental health intervention. First of all, concrete assistance. Anybody who works with families out there know if you can't put food on the table or don't have a place to live, those are stressors that we absolutely need to address before we can do anything else. Also, emotional support. I think we forget that kids aren't born with manuals. It's not like a how-to. And then you kind of add in there different temperaments and different personalities, and then also your own experiences as a child, right? Your own relationships with your parents. Sometimes I'm talking to my children and my mother comes out and I'm like, whoa, where was that? So, we sometimes just need emotional support in the raising of our kids. It takes a village. We need to have peers and professionals and just support services in general when raising kids. Developmental guidance, which is so important in those early years, because children can go through phases, completely developmentally appropriate phases. And sometimes you might think, oh, is this a mental health issue, or is this something that I need to worry about? And we really need to have better relationships with our pediatricians, with our early childhood workforce, to have somewhere to ask those questions and to really know about sort of the developmental milestones and what's normal, and when do we need to start paying attention, and when do we need to start getting help. So that's just like with a physical disability or a speech issue. It's the same for social emotional issues as well. We just need to do a better job of sort of building that system and being able to talk about those things. So being aware of developmental milestones is a big service that we need to pay attention to. As I talked about, early relationship assessment and support is something absolutely critical to infant early childhood mental health services. Of course, advocacy, anytime we're talking about social emotional health, mental health, sometimes policies and rules and regulations don't always support what's the best interest of the child. So we're working on that. So to have an advocate or somebody who you can talk to about what are policies and rules and regulations around supporting young children that need some extra support, social emotional support. And then finally, infant and parent psychotherapy, which I'll talk about a little bit more in a minute, but it's sort of what I was saying, that even when it's an infant that's having perhaps attachment issues, maybe they're not making eye contact, maybe it's a foster child and you're working with a foster parent because the child came out of an abusive home or a substance abuse addicted biological parent. You're really working with the infant and the foster parent. It's not just the infant, right? It's not just a play therapy approach. It's really an approach of working with the caregiver and the child together. So you might say, well, Laura, what's the prevalence of this? Is this just a few kids or is it a lot of kids? Well, unfortunately, it's a lot of kids, maybe a lot more than you would think. 1 in 6 U.S. children aged 2 to 8 have been diagnosed with a mental, behavioral, or developmental disorder. So again, that early childhood window is absolutely critical for identifying issues, not just mental or behavioral, but also developmental. Because we know mental, behavioral, and developmental disorders absolutely begin in early childhood. You don't just show up, in 6th grade and then have social emotional issues or a developmental disorder. Those signs are there far before that age. So 9 to 14% of children ages 0 to 5 do experience emotional or behavioral disturbances. Again, same rate as school age children. So we put all these services and supports for school age children in place. But we don't always have the same services for that 0 to 5 population. And that's part of the work that we're trying to do. And then also, just to kind of further the point, globally, we know unfortunately more than 5 million children have lost a primary or secondary caregiver due to the pandemic. So you might say, well, Laura, that's all children, and that's all over the whole world. But that's sort of my point. It's all children. Infants and toddlers have lost people too. So we have to have a system to better support that. Because again, we understand how important those primary and secondary caregiver relationships are in early childhood. So getting kind of into the systems work, just to kind of further underline that we have our work cut out for us. DECAL, the organization I work for, the state organization of early care and learning, did a assessment using the Georgia Preschool Development Grant in 2019. And what they found was for the birth to 5 population, there was limited or no access to mental health services in Georgia, that we needed further development of supports and resources to address persistent challenging behaviors in children and families impacted by trauma, that we needed a credentialing program for our professionals to provide mental health services for children birth to 5, and that we need to invest more in 2-gen strategies and programs, which again is just caregiver and child, that sort of dyadic approach. So there was a legislative committee on infant, toddler, social emotional health, and they really recognized everything that I've just been talking about. And they decided that we needed to establish some state leadership to really build the system to better support social emotional health for infants and toddlers. So my position was created in 2020 and housed at DECAL. And we formed the Infant Early Childhood Mental Health Task Force with all the child-serving state agencies represented. And we've been convening for over a year now. What kind of helped us out with these recommendations is that they are very closely, really parallel to what we already were working on in the Georgia System of Care State Plan. So the Department of Behavioral Health and Developmental Disabilities has the interagency directors team. Some of you might be familiar with that. That really just look at sort of children's behavioral health and the systems and trying to work together to build a system of care to better support children and families for mental and behavioral health issues. So these were very similar. They already had these very similar goals that we were working towards. So I won't read them because we're going to go through them in a second as far as what we're doing, but just to again show sort of the parallel that we already had some people sort of at the table and ready to work because of the Georgia System of Care work. So it was sort of easy for us to cultivate some champions around this work. So we were really all able to come together with the goal to build Georgia's early childhood system of care together. And I have together underline, exclamation point, big lights flashing, because DECAL is not trying to do this by ourselves. We are more than happy to lead, facilitate, coordinate, do whatever we need to do, help with funding for, which I think is a big piece, to address some of these things. But we also immediately recognize that we need public health, we need behavioral health, developmental disabilities, we need community health. We need all of these other organizations on board with us to really truly build an early childhood system of care, because we're not just trying to work with child care centers. And in the child care lane, we definitely are doing some things for that lane, and I'll talk about those things in a second. But really, this is for the whole state of Georgia and every child in Georgia. So we really want everyone to have a role and work with us. So it's not just child care, it's also early intervention, and it's also home visiting and all these other great programs that are out there working together. And I think this graphic sort of represents that we really all have a role in promoting social emotional well-being for our infants and toddlers. So the role of the Infant Early Childhood Mental Health Task Force is to build and sustain a comprehensive and collaborative early childhood system of care in Georgia. So how are we going to do that? We're going to promote coordinated policy and collaborative service delivery. We're going to support young children and their caregivers to address social and emotional health needs. Note that I put caregivers too, because again, we're not just trying to, work with infants here. We're working with their caregivers. So adult mental health is a part of this, a key part of this. And also, again, promote that early relational health, how children and parents, caregivers and children bond with each other, especially in those early years. And we really separated ourselves into 3 different buckets: promotion and prevention, policy, finance, and workforce development. So again, you can kind of see there's a systems approach here. We're not just working on one aspect of this. We're really trying to approach this in every system so that we can touch every child and every family. So we're going to start with workforce development. Part of why I think we've been successful thus far and made such progress in the last couple years is because of the great champions we have. And I'll be mentioning all of our workforce chairs throughout. But I just wanted to put the spotlight that we've had great partnerships. And that is the key for us to be successful in this work. So on workforce development, we have Callan Wells from Gears leading that work, and then also Dr. Chelsea Morris, who is with the University of West Georgia. And if any of you knew about, saw DeCal's Children's Mental Health Week, you might be familiar with Surrey the Spider. Well, Dr. Morris is the author of the Surrey the Spider book. If you're not familiar, you can Google and get that book. But she also is the director of the Early Learning Center there at the University of West Georgia. So a couple of great partners there to lead this work. One huge thing that we've done in Georgia is establish the Georgia Association for Infant Mental Health. And the webpage is there, and I think Diane will put it in the chat box as well. But what is the Georgia Association for Infant Mental Health? It's basically a chapter of a national association that sort of houses the core competencies for the workforce, for the early childhood workforce around infant early childhood mental health. And that can be, when you unpack what I just said, that's a lot, because when you think of who is the early childhood workforce, it's several different folks, right? You've got pediatricians, clinicians, early interventionists, childcare providers, home visitors, and all of those people are housed in different places, right? So what we're really trying to do in Georgia, and what the association is really aimed at doing, is sort of bringing together sort of a workforce initiative so that we can train everybody at their own level around those core competencies. And I'll talk about that just a little bit in just a second, but I did want to mention that we are having our kickoff event October 5th this year. I think it's 9 to 3, so it's an all-day thing. It's in person so far. Hopefully we don't have to say that and cross our fingers that things stay in person. But if you would like to sign up for that, you can go to the website and join the mailing list. Just scroll down a little bit and go to the right and click on join the mailing list. And you'll start getting information from Georgia AIM about all kinds of workforce development training. Because I think the first thing that we have to recognize is that our workforce needs to be trained on what infant early childhood mental health is, and those core competencies around what to do if a parent comes to you concerned, or how to recognize if there is a emotional or a social emotional concern early on. So that's what Georgia AIM is all about. I also want to mention that we are, I think, the 33rd state to have our own association. So we have lots of other states to learn from. We are certainly not the first to do this, which is, good in the sense that we can learn from other states and partner with them. But this is a sort of foundational thing around infant early childhood mental health, is training the workforce, and this is our vehicle to do that. So just to kind of unpack a little bit more about endorsement. as I was saying, the early childhood workforce can be very varied in their educational background and how they interact with the child and the family. So there's different endorsement pathways. But what I think that you'll find is that there's space for everybody. So you should be able to look at what you're doing and your involvement with infants, toddlers, and their families and find where, and find where you might be able to fit in here. And that's what the kickoff is for in October, is sort of to roll out what this looks like and how you can apply and how you can learn more about becoming endorsed. And this is actually sort of a credential. You would put more letters behind your name, you know, like it's a academic credential that would support you kind of, it will basically say that you know all the core competencies around infant early childhood mental health. And in other states, sometimes the endorsement is required for some positions. So we're working on how we're going to roll that out and support the workforce in participating with that. So you guys are kind of getting the preview of here's what's to come. And again, if you're interested, I would sign up on that mailing list because as we roll that out, you'll be first to know about the opportunities. So the other thing that we've really done in the workforce is that we noticed right away, just as the PDG assessment said, there's no mental health services for this age group. I shouldn't say no, there's very little. If you're in Metro Atlanta, you might be able to find some. If you're in rural Georgia, they're probably not. So we really prioritized that we really needed to expand our workforce for those infants and toddlers and families who are sort of on that deeper end of traumatic stress, toxic stress, who really need sort of that infant and parent psychotherapy. So we have invested in the child-parent psychotherapy model, which is an evidence-based treatment. It's dyadic, which basically means, again, it's not just with the infant or child alone, it's with the parent and the caregiver, which includes a foster parent, whoever is taking care of the child. And it really has wonderful outcomes for addressing grief in children, for addressing past abuse, for just those really heavy things that we don't want to wait to address until they're acting out in middle school. And it's just, we're so proud that we were able to, DECAL and Department of Public Health were able to pool funding to train 60 child-parent psychotherapists that are actually going to start their training in a couple months. And we did a pilot group of about 15 to kind of dip our toe in the water and see how this worked. And it went really well, and we had great outcomes, and families were just very grateful for the service. So our goal is to expand the service across the state. So while we're training 60 clinicians now, that's still a drop in the bucket. We still have lots of work to do. But I hope that people who will need to make that type of referral will be able to look up, here's the child-parent psychotherapist in Georgia, here's one that's near me that I can connect with through telehealth, or it's in my area. So that's something that, again, on a statewide collaborative, it's been a statewide collaborative effort to fund and support strengthening our workforce in that area. We also have invested in training around the DC 0 to 5. Those of you who are familiar with the DSM or the ICD-10, those are clinical diagnostic manuals for children and adults. But 0 to 3 really felt like we needed a supplement here for the 0 to 5 population, because as I just mentioned earlier, sometimes kids go through phases, and you really have to understand child development before you're ready to diagnose with a mental health issue or social emotional issue or even a developmental issue. So they built this guide, and it's been revised a few times. In fact, it started as a DC 0 to 3 but they expanded to DC 0 to 5. And it really breaks down, when is it appropriate to diagnose anxiety? When is it appropriate to diagnose, can't think of ADHD, things like that. I was trying to think of different diagnoses. So we really want to, sort of the next step in our workforce journey is bringing the DC 0 to 5 to Georgia and having it sort of be recognized by the workforce as a resource and a tool that can be utilized to better identify and treat young children and their families with social, emotional, or developmental concerns. So we've invested quite a lot in some training, some initial training. So the task force members that I just spoke of before were offered to go through the whole clinical training. So myself and several others went through the complete clinical training to understand. I have the book here, I have lots of little tabs. So went through the whole class and to really understand what's the difference between a 0 to 5 diagnosis and a DSM or ICD-10 diagnosis. And really the truth is it's just more assessment around the relationship, because as we talked about, that's just sort of a core component of social emotional growth with young children, to put it in a nutshell. And I think we're working on right now a DC 0 to 5 and ICD-10, which is what we use in Georgia for Medicaid, crosswalk. So you can use the DC 0 to 5 to make an age appropriate diagnosis and then crosswalk that with what that would look like in the ICD-10 to bill. So we'll get into billing in just a second, but that is a key process for providers who are trying to provide evidence-based services for young children. All the child parent psychotherapists will be trained in the DC 0 to 5. So that's another way that we're expanding that knowledge. And through Georgia AIM, we are also partnering with them to provide clinical overviews of the DC 0 to 5. So people are more aware of it. Just like now, if you had never heard of it, now you're more aware of it. And to know that's a resource and tool that can be utilized. So that takes us to policy and finance. So I've talked about all these services and training the workforce. Well, none of that matters if you can't pay for it, right? And before I talked about sort of policies and rules and regulations, sometimes just policy doesn't match up with real families and real children and what they need. So I got two of the best ladies you can in Georgia to talk about policy and finance from the Georgia Department of Behavioral Health and Developmental Disabilities, Wendy White-Ty-Green, who also used to be my supervisor in another role, and then Catherine Ivey, who is recently retired. So we are working with the interim chair now, but she is pretty much the everything Medicaid, children and Medicaid person for Georgia, of course, from the Georgia Department of Community Health, who's the Medicaid authority in Georgia. So the easiest way to do this, I can't make this much flashier more exciting with finance and policy, is just to sort of house study recommendations here. And if you remember when I put up the state system of care state plan recommendations, they're very similar, right? So these were the actual recommendations for Medicaid and billing codes and the DC 0 to 5. So as you can see here, we have already checked off 3 of these, which is amazing. If you've tried to do anything with policy in less than 5 years, you're doing pretty good. So again, I cannot underline more that our partnerships and the leadership around sort of this work, having legislative support, having DBHTD, DCH, public health, education, everybody kind of at the table and really agreeing with that some changes need to be made is what has gotten us to this point. So to sort of wrap all what this means up is that right now you can go to the DCH website, and I didn't get the link because those who aren't providers, it might just be confusing, but if you want to search for it, you can go to the DCH website and find a Medicaid services chart for birth to age 6. We created that. And what it is it's specifically for providers to help them bill for services, just like the services I talked about earlier, because there's actually ways to bill right now today for services that I talked about for the 0 to 5 population. And I think before we started in this work, that's why it says clarify billing codes. Because a lot of people didn't understand that you can bill for infants and toddlers. If you have more questions about that and how to access that chart, you can just email me. I'll share my email address because I know some folks kind of are like, oh, Medicaid, let's go to sleep now. So I don't want to get too much in the weeds with that, but just to let you know, we are making it easier for providers to bill for evidence-based services for infants and toddlers. And then we are sort of in the plan with the DC 0 to 5 crosswalk, or are in progress with the DC 0 to 5 crosswalk. And then also just working on guides, again, of how to bill specifically for like child parent psychotherapy, what buckets you can bill for what types of insurance cover that. So there'll be more to come from that. And again, if that's your interest area, I'm glad to share more information with you.
Laura, we just had a question pop up.
Yeah.
What's the cost for those interested to do the CPP?
The cost? Okay, so public health and DECAL are covering the cost for the clinicians. I will tell you it's very expensive. That is why it's helpful to have 2 state agencies partner and fund the training costs. Most evidence-based models are very expensive. We are looking at, there's other folks in the state who have also jumped on board and written grants. For example, the United Way in North, what side is that? East Georgia wrote a grant and were able to fund a smaller cohort, I think of 20 folks being trained in child parent psychotherapy. And then there is a cohort, I think, applying for funding in the southeast corner of Georgia, which would be fantastic because that's where we don't have a whole lot of coverage. So if you're interested in that, you have to be a master's level mental health clinician. And we had a whole application process, but we're running all of our training opportunities through Georgia AIM. So again, if you go right now to the Georgia AIM website, you can actually scroll down and see the training opportunity for child parent psychotherapy. Now the 60 have already been selected, so that opportunity is closed, but if there are other opportunities in the future, you would know through that mailing list, or you can visit the site to see.
And that link is in the chat.
Yes, thank you. I don't know the exact cost. I do know it's very expensive. You can also go, Diane, I also gave a child parent psychotherapy, just, yep. So you can go there too. Thank you. You can go there directly and learn more about that particular model as well. Thanks for the question. Okay, so the other things that we had to do around policy and finance and just kind of general understanding the lay of the land is we decided to work with Georgia State University to do an infant early childhood mental health systems analysis. First of all, they provide great research and subject matter expertise related to Medicaid policy and data, because that is a job all in itself. They also created some heat maps reflecting program availability for this age group, which I will tell you was sad. We didn't have much availability at all. So again, that just sort of gave us some fuel to really talk about that we needed to invest more on workforce development and policy and financing changes. They are our evaluator for the child parent psychotherapy training pilot and the newest cohort. And then they also helped us develop an issue brief, which Diane will put in the chat if she hasn't already, that really talks about where Georgia is right now and sort of next steps for Georgia. So please review that and share it widely. I think if anybody doesn't know what infant early childhood mental health is or doesn't really get what Georgia, why we're doing this, or what the system building looks like, that's a really good document. It's we call it a one-pager, but I think it's 4 pages. That really just sort of lays the land out for you about infant early childhood mental health systems development here in Georgia. So that takes us to the final work group, which is promotion and prevention. And there's so much under this work group that I had to have some, again, dynamic leadership. So we have Dr. Terry McFadden, who many of you might know. She's a pediatrician who is just very much so an advocate of early relational health, ACEs prevention, positive relationships, and really a pediatrician's role in supporting all of that. And then we're also working with CHOA, Erin Harlow Parker, just to tie in Children's Healthcare of Atlanta and all the great work that they do for children. And again, the partnerships have really moved this ball down the road a lot quicker than we would do on our own. So again, grateful for our partners. We have a lot of things to mention in promotion and prevention, and I always start off with Georgia Department of Public Health, who are huge partners, again, with helping us expand child-parent psychotherapy in Georgia. But also we partnered with them to do a study around home visiting, because we know when we think of sort of the continuum of services that children and families need access to, home visiting is absolutely a vital service, and it's right in here in our age group. As they are specialists in sort of that infant and toddler area, sort of identifying issues, addressing those issues before kids start school. Because again, mental health does not start right when the kid walks through the school door, right? There's a lot of work that can be done before that. And home visiting is such a great program that supports some of those services that I talked about before, especially that concrete assistance, that emotional support. And they are just experts at referring out for other services and connecting the family with what they need, including job skills and transportation and things that we just sort of, I think, take for granted sometimes. So we really partnered with them to do a study through Emory University, not anniversary, university, to look at the impact of Georgia's home visiting program, particularly on social emotional learning and emotional wellness. And of course, those results are just coming back. So we're waiting for the one pager and ways to share it. But as you would guess, it strongly supports social emotional health. So we're big supporters of home visiting. We also worked with Resilient Georgia, who has a lot of different sort of regional coalitions around the state to really just build a more trauma-informed community and build resilience in communities. So we DECAL funded them to expand that work to the 0 to 5 workforce, because trauma doesn't start, unfortunately, when you are 6 years old. Toddlers and infants, unfortunately, have been through this too. Caregivers, adult caregivers, are still, dealing with their trauma and trying to build resilience for themselves, and that has a huge impact on the children that they're raising. So we delivered a couple of trainings in community resilience model and mindful self-compassion across the state, with, again, trying to include the 0 to 5 population through the workforce. I kind of said that like it was like infants and kids going to those trainings. Sorry, it's the adults, it's the workforce that we invited to those trainings. And then also sort of looking at early care and learning and how we can maybe build resiliency zones. So we're piloting a few things, and we'll continue to support the development of how to build more resilience and trauma-informed communities across the state to support infant and early childhood mental health. Also, I became a certified trainer in the Growing Brain, which is a curriculum from 0 to 3. And I have been working with DECAL's infant and toddler specialists on 21 hours of content, and we're still working on it. It feels like we've been doing it forever, but we're only halfway through. I keep on having to reschedule. But I, again, want to reiterate the partnership and why I'm here today with Better Brains for Babies. We're working together collaboratively to see how we can just get the knowledge out there about the importance of how to support early childhood brain development and that key component of social emotional development, and the opportunity there. And then my favorite, DECAL needed to make children's mental health and infant early childhood mental health their own. I've talked about a lot of the systems work, policy and finance, workforce development across the continuum of services. But DECAL also wanted to do something specifically for childcare providers and teachers, pre-K teachers. So we wanted to recognize children's mental health and sort of just promote the idea. We're reducing the stigma. Again, emotions aren't scary. They're messy sometimes, but it's not scary. So let's really promote mental health in a fun way, with Callie and doing dance parties for Feeling Friday and puppet shows and reading books about a spider who doesn't know what to do, but figures it out. Mental health and emotional wellness can be fun and exciting. I always kind of compare to oral health. We have like the dancing toothbrush and the dancing teeth come in to classes. You give away little baggies of toothbrushes. Your insurance starts paying for children to go get preventative cleanings at an early age. What are we doing for social emotional health and wellness? I mean, why aren't we talking about that from the very beginning, not only for the children, but also for the parents, so that they are more comfortable to get services when they need them, which has a direct effect on their children. Was that a question? Did somebody have a question? No. So we did puppet shows, we read books, we did lots of just celebratory things around children's mental health. And I tell you, the kids love it. They love when Callie shows up dancing about Feelings Friday, and it just makes it less scary. And I think for this age group, that's what we need to do. Because my favorite, Mr. Fred Rogers, I grew up with him. Many of you, I'm sure, did too. He has so many great quotes, so it's hard to just pick one, but I think this one really sums it up. That if you want your kid or the kids that you work with to learn their ABCs and 1, 2, 3s and do well in life academically, guess what? A love of learning has a lot to do with learning that we are loved. And that the opportunity for that is from the very beginning. So I have a little video for you guys. I'm going to play this and then wrap up my talk. So Diane, let me know if it plays wonky. But this is a video that DECAL created around Children's Mental Health Week to do exactly what I'm talking about, promote early relational health and promote the importance of caregivers and adults in children's life. So here we go.
Children are shaped by their earliest experiences and relationships, and often communicate through their behaviors. We know that 90% of brain growth occurs before kindergarten, so it's up to the parents and caregivers of young children to use this window of opportunity in early childhood to create the foundation for social and emotional health. The single most common factor for children who develop resilience is at least one stable and committed relationship with a supportive parent, caregiver, or other adult.
Will you be the one to show me that I am important? To teach me how to calm myself when I feel upset? To be there for me when things are tough? To help me solve problems? To teach me how to be a good friend? To show me how to play with others? To make me feel safe? To show me I can do hard things?
I am the one who can teach coping strategies,
Help a child build self-confidence.
build a child's resilience,
Provide encouragement.
show a child how to connect with others,
Help a child be part of a team.
make a child feel safe and secure,
Model self-care.
really listen to a child,
Love them just as they are. I can be the one to support a child's mental health and build resilience. Will you be the one to make a difference in a child's life today?
Unmute. I hope you enjoyed that. Diane should put the link in the chat, and she did. I see her nodding her head. Please use that video. It's made for everyone to use, and the more that we can get that message out there, that adult caregivers are really just so powerful. And really any adults who are interacting with young children really do have that power to support social emotional development and wellness. So I hope you enjoyed that, and please use the video. It's located on Decal's YouTube. If you ever lose the link, you can just search that. So I got to wrap up. Next steps. What can you do? Again, join that Georgia A mailing list if you are interested in any sort of workforce development training opportunities. They will be coming, and that's where they'll be coming from. You can visit our Decal Infant Early Childhood Mental Health web pages for resources. There's two of them, the Infant Early Childhood Mental Health web page and the Children's Mental Health Week, which I leave up all year because it's not just important for a week. And they have tons of resources at the bottom. And in fact, this year we really focused on teacher self-care resources, sort of recognizing that when adults are stressed out, they're probably not doing the best that they can for their kids. So really self-help, getting sort of adult mental health resources is just as important as for the kids. Again, share our video. It's out there to be shared. And then just remember, every interaction counts, and that caregivers play a key role in social emotional health. Many of you know about our SEEDS helpline through Decal. That's something that folks can call and get services and supports and referrals, especially child care providers and teachers. We also have Learn the Signs, Act Early. If you've heard, they've come out with new milestones and new checklists and new information. And we have our ambassador, Bridget Radijak, who is housed at Decal, and I understand is coming to a future Better Brains for Babies webinar to talk about that. Understanding developmental milestones is the first step, and talking to parents about social emotional concerns. This is the vehicle for that, understanding development and using some of these great materials just to educate parents around that is the way to go. So I will end with saying early is better, but it's never too late. When I was a child and family therapist, I worked with a lot of teenagers, a lot of adolescent type folks, and we made lots of progress. But what was the same as the relationships? Relationships is what makes the difference. So sometimes I do this talk and folks are like, oh, we missed our window of opportunity. Absolutely not. You can work with kids and families and relationships at any time. While it's better to be early and there is a window of opportunity there, obviously children and families always have the opportunity to grow together for change. So here's my email address. If you have any other questions, and here's our webpage with which Diane shared with you, and I will stop sharing. And I know I didn't leave too much time for questions. Diane?
Thank you so much, Laura. Such great information. I'm going to